Prelinguistic Milieu Teaching and Responsivity Education is presented by Juliana Cure, Jamie Weinstein, and Maggie Young.
This intervention is a client-directed approach and it has the purpose of increasing intentional communicative gestures, vocalization, and eye gaze in children. It also increases the parental responsiveness, which allows parents to read communication intents and be responsive to them. This is important because the parent needs to acknowledge when the child is trying to communicate, or the child may learn that using gestures is not doing anything. This intervention approach involves prompting, time delay, recasting, imitation, and parallel talking, and also involves establishing a routine. You want to use this intervention approach with children ages 9 to 16 months who are not meaningful communicators. You also want to make sure that the children have a mental age of at least 9 months. Their expressive vocabulary should be less than 10 words, and their receptive vocabulary should be less than 75 words. In addition, you want to make sure that they are using less than one gesture per minute while in a social context.
Fay et al. Looked at the early effects of responsivity education / prelinguistic milieu teaching for children with developmental delays and their parents, and the study found that RE/PMT significantly increased requests and comments in children. This helped to make the children more intentional communicators. Fay also found that the clinicians did not model for the children what to say. Rather, the clinicians acknowledged the communicative intent of the child and added on to it. Warren et al.'s study, a randomized trial of longitudinal effects of low-intensity responsivity education / prelinguistic milieu teaching, supported the use of RE because it uses strategies that involve teaching parents to identify their children's nonverbal communication acts, and then to respond to those acts, which will strengthen children's efforts and help them understand meaningful ways to communicate their messages. When this is learned, PMT can be utilized, and according to Warren, within PMT, children learn to communicate more effectively by switching their gaze from objects to an adult by combining that attention with gestures. This results in the expression of clear prelinguistic comments and requests. Yoder et al. Looked at the effects of prelinguistic milieu teaching and parent responsivity education on DIADs involving children with intellectual disabilities. The study found significant gains for parents who participated in the RE/PMT. By increasing the parent's responsivity, the child had an increase in their comments and vocabulary.
Our case involves Ben Smith. He's a 3-year-old, 4-month boy who was referred to the Speech Language Institute by his pediatrician. Per the case study, his parents reported that Ben is delayed in his communicative and cognitive abilities, though he has not been formally assessed yet. They mentioned that Ben has not met his developmental milestones on time. When it comes to communication, he does not communicate with any sounds or gestures. They mentioned that he can probably understand about 10 words or less, but he does not say or use these words. When it comes to object permanent skills, he does not know what to do with objects. The parents mentioned that they are willing to help Ben in any way that they can.
The therapist recommended 4 pre-intervention measures that are appropriate for PMT and RE. The MacArthur-Bates Communicative Development Inventory is a parent report instrument. Vineland-2 Communication and Social Domains is norm-referenced. It measures cognitive, linguistic, and language literacy skills, and aids in diagnosing and classifying intellectual and developmental difficulties. Communication and symbolic behavior skills is norm-referenced. It involves parent interviews and direct play observations. It surveys communication skills and gestures, facial expressions, and play behaviors. Lastly, a language sample, which is given under low demands.
Ben's assessment results were as follows. For the MacArthur Communicative and Developmental Inventory, which identifies information regarding expressive and receptive language and grammar, Ben scored in the severe range with a below 1% rating. The therapist decided to assess words, but not sentences. Ben demonstrated difficulty with the words, therefore sentences were assumed to be difficult for him as well. He understands but does not say hi, mommy, daddy, more, ball, bed, eat, and cookie. During the Vineland-2, Ben once again scored in the severe range with a below 1% in communicative, daily living skills, socialization, and motor skills. Those are the 4 subtests for the Vineland. Lastly, the communication and symbolic behavior skills were given. Ben once again scored in the severe impairment range for gestures, play skills, and expression. The parents report that they are responsive to education.
Look at
right, the blocks, Ben. I have 2 blocks. We rolled the block and a red and a blue block. Let's roll the block. Nice job. We're rolling the block. And I'm going to put the block on top of the green one. Look. I put the blue block on top of the green one. There's a red block. Let's put it on top of blue. Roll. Put on top of blue. Nice job. I have a green block. Nice looking, Ben. I'm going to put it on top of red. Here's another block. You have a red one. We're rolling. Put on top of green. On top. Oh, so close. Oh, so close, Ben. Nice job. Do more blocks. I have a yellow one. Roll. All right, I'm going to put mine on top of red. Nice looking, Ben. I put mine on top. Can you get yours all the way on top? Roll. Put on top. Nice job. All right, should we knock it down? Oh, bash! We got them all down. All right, Ben, we're going to look at some cars. Look at the cars. Nice looking at the cars, Ben. Do you want the gray car or do you want the blue car? Nice looking at the cars. Blue or gray? Gray. I want the gray car. We're rolling the car. Ready? 1, 2, 3. Push. Flip. We're rolling it back. Push. Nice job, Ben. Oh my goodness, we pushed it so far. Hi, Mrs. Smith. The reason that we're meeting is because these next couple of sessions we're going to work on your ability to be responsive to Ben and increases overall communication. Do you have any questions?
No, I'm excited to work with you and become more responsive.
Great.
It is encouraged to use each of the following strategies as demonstrated in our video when using PMT to have the best results. An important strategy that PMT uses is called linguistic mapping. This is when the clinician that the child was interacting with put words to the child's nonverbal way of communicating. The clinician kept stating that what she was doing so that Ben could map it on. This type of strategy could also be considered interpreting the child's nonverbal acts.
The next strategy that we used was building social play routines. You can do this by having the clinician and client take turns while playing games. So in our example, we had stacking blocks, and the clinician would put a block on, then the client would put another block on. This could also be used for the parent when they use these games at homes.
2 additional approaches that we used included waiting for the child's lead, which we had for the child waiting, for the clinician waiting for the child to look at the clinician before doing the activity, and additionally we did following the child's attentional lead. Fay, Hepting, and Goldstein mentioned that following the child's attentional lead, a universal tenet of virtually all naturalistic early communication and language intervention approaches is effective. It's used to sustain the child's interest in activities and social interaction. In practice, this might mean that the adult plays with toys or engages in activities of interest to the child. In a similar manner to the child's play, children who are passive and engage in low rates of action or children who engage in repetitive behavior can make it challenging to maintain this procedure. Adults can easily lapse into directive styles in which they dominate the interaction styles with the child. Our experience suggests that if the goal is to build initiations, then it is better to simply adapt one's behavior to what the child is interested in, even if it's low. This technique is easier to implement if the child has made some effort to arrange the environment to increase the likelihood that the child will attend and react spontaneously to target stimuli in the intervention context. For example, we removed all distracting objects from the area so the child is only able to engage in the activities that were preferred.
Responsivity education was shown by having the parent and the clinician meet. This was a way for the clinician to start talking to the parent about how to become more responsive to Ben.
Thank you very much for watching. We hope you enjoyed it.